I was ready to retire and enjoy life with loved ones and family in Quebec City, our hometown, and our life changed completely.
That's when Bob and Suzette got the call that would change their lives forever. Their son, Michael, had been in a devastating car accident.
And the van that they were in flipped over 2 or 3 times. And that's how Michael sustained his brain injury. His youngest son, 6 months old, was also severely injured, sustained a traumatic brain injury. He was put into a coma for a few days. His wife had some physical injury, and their daughter, thank God, was uninjured.
They got on the next plane and never left his side.
Michael was in a coma for 6 months. Doctors said nothing could be done. By coincidence, through my youngest son, Dwayne, his father-in-law on TV heard about hyperbaric oxygen therapy. So I started doing research.
So hyperbaric oxygen therapy is, the word hyper is sort of above, and baric is pressure. So you're delivering a high pressure oxygen to the body. And what happens is red blood cells carry oxygen. We normally, when we breathe air, it carries oxygen. But in a hyperbaric situation, it's pressurized. So there's a lot more oxygen that's carried into the blood. And that oxygen then goes into the plasma, and also goes into the cerebral spinal fluid, and also goes into the lymphatic fluid.
Hyperbaric oxygen therapy has demonstrated benefits for a variety of health issues. To date, however, conclusive evidence does not support using it for patients with brain injuries. But that didn't stop Bob and Suzette from trying.
We undertook these therapies against doctors' recommendations because doctors were not knowledgeable of the benefits of such therapy for brain injury. They recommended that Michael be put into a permanent home, and we did not accept that. So I contacted every single hospital in Canada, from Halifax to Vancouver, every single hospital who had a chamber, and none of them would accept to take Michael in the condition he was in, none of them.
After an exhaustive search, Bob finally found a clinic in Richmond that would take Michael on as a high-risk patient. Doctors at the Richmond Hyperbaric Clinic were confident that there was something they could do.
When Michael was brought into the chamber with the paramedics, Michael was in a total fetal position, and he was only tracking to the left. And after the 3rd hyperbaric treatment, all of a sudden, Michael started to focus. And then after the 4th treatment, Michael started to move a small finger.
The Cosses also tried other alternative therapies like Locomat, but attribute the majority of Michael's progress to hyperbaric oxygen therapy, which he continued for 2.5 years.
We started the treatment at the end of October 2006, and by Christmas time, Michael was saying his first word. We were seeing progress all the time, and today we're still seeing some progress. So
now I'm able to walk around the house and to see my kids with only a cane.
Not only can Michael walk, but he can do a whole host of things that doctors said he would never do again. None of this would have been possible if the Cosses had accepted no as an answer back in 2006.
Okay, when I woke from my coma, my 6-month coma, I decided that I wanted to make a difference and that I wanted to inspire others to be the best that they could be. The first thing I did was to write a book called The Courage to Come Back. The purpose of me writing this book was to inspire others to be the best that they could be in their own situations.